Hey guys, this is Jay, and here's Patfoot yet again. Oh my gosh. Anyway, I've got news to report, so I'm going to do a little video today. It's kind of going to be short about my experiences doing the phone consult and getting my top surgery scheduled. Um, I think that this helped me, so I hope that maybe it will help other guys. Try to figure out what's going on and that sort of thing. Anyway, Dr. Garramone's office said that he would call between this window, and it was like 9 to 4, which is something. It's a big window. He's in my lap. This is kind of crazy. Anyway, so he called me at 1:30, which is different than I've heard other people say. Anyway, I'm glad somebody really warned me that it was, well, on a video, said that he's really rushed and it's not very, like, personal, kind of. It seemed like maybe he was going through a checklist. He asked me about my, medications I was taking, medical conditions I had, surgeries that I had, family history, my own problems, any kind of medical problems. And it just seemed like a little short history kind of thing. He told me that he would do a DI, which I knew pretty much. And kind of briefly what that was, which was not new at all. Um, and then, some procedural kinds of things, and said that he put me in touch with his office, which they would answer all the questions. Um, and then asked me if I had any questions, and I asked, about scars, and he said basically, he wouldn't. I thought maybe with the pictures, I had to send him pictures, sort of X-rated pictures of myself, and he said that um, they would, where the scars were was to, he had some goals, and he gave me his goals, which were, like to have a male appearing contour and to, have the size, nipple size and placement and all that. But he didn't really he said, well, whatever I do is to have these goals. So I thought that was actually a good way of answering it, but of course it doesn't really answer the question. But I think my pictures, I don't think they're that good, so I don't think he could answer them from that, and I don't think he would anyway. Unless it was fairly obvious, I guess. Um, so like the reason scars are joined is to prevent puckering. And he said it can happen with really small breasts, or, it doesn't really matter about the size. I thought that was interesting because I didn't think that. I asked him if I could take Sudafed uh, and something else during flying, and he said that was fine. And he had his list of things you can't take, and it was pretty inclusive. And then he was interested in my last question because it was about um, my age, and he said, well, no, yeah, I've had other 65-year-olds as patients, and that he thought that I asked him his oldest, and he said that was about 65, which I thought was, no, 70, late 70s, and I was like, oh man, that's old. Okay, anyway, and then, because I don't think I'm old, of course. Um, he was really kind of understanding. He said, well, he thought that he could see why we didn't know about it, and that the internet has enabled people to know really earlier, very early now, and that back then we didn't really know what was what, basically, and have the resources, like to even know if we did know that much. I mean, I wasn't that far, but I wasn't talking about that. But we, should have the right to feel like we felt like we should feel, which I thought was a good. I mean, he didn't put it. I don't know how he put it exactly. Um, then he gave me to Jessica. Ah, Jessica. Yes. Yes, I flirted, I have to admit. And, but anyway, my surgery is going to be the 29th of October. My pre-op is the 28th at 11, and my post-op is November 4th at 9:30. So now I know all that stuff. It's pretty cool. Then I called New Beginnings, and I'm going to be in room 3, which was the only little room left. I would have taken 2, because that sounds cool with the balcony, but anyway. Um, so I didn't make my plane reservation because my visa's pretty well maxed out, so I paid a bunch on my visa. But I looked at the plane ticket. I have to fly through Houston Hobby or Dallas Fort Worth. Oh, joy, I love both of them. Anyway, not. Anyway, um, I know there are guys out there who have October, end of October, early November, top surgery dates. Now, come on, I want to know who you are. So, anyway, let me know, and thanks for watching it, everybody. Bye.